This video's aim is to help if you are suffering from patella tendinopathy in your knee. Within your knee joint there are three main bones: the femur, thigh bone, the tibia, your shin bone, and the patella, your kneecap. There are also ligaments which help to stabilize the joint, tendons which connect bones to muscle, bursa, which is a fluid-filled sac which helps to prevent friction within the knee, meniscus, which is the cartilage. This acts like a shock absorber. The patella tendon is below the kneecap. Any of these structures can be injured, causing pain in the knee, and it is possible that your injury could include these structures as well, or instead of the patella tendon. Tendinopathy is basically degeneration or microtrauma of the tendon, and contrary to popular belief, there is usually no inflammation. The most common cause of patella tendinopathy is gradual progressive overload, which can be overtraining, not enough recovery time, or even biomechanics. You need to have applied load through the tendon, for example running, jumping, and not from activities such as swimming. Swelling is uncommon, although there may be some thickening of the tendon. The knee can give way, but this is more in response to pain, so if it is minor, then it shouldn't give way. Although trauma isn't a common cause, it can be triggered from a trauma to tip it over the edge into a symptomatic condition. A patella tendinopathy can fully resolve without surgery, and on average it takes 16 weeks to resolve if you had sorted out the issues causing it. Physiotherapy can help you to establish the reasons behind why you have the condition, and the treatment can speed up the healing time. If you are unsure based on the content of this video, which is just a guide, then book an assessment with your physiotherapist. Due to the complex nature of the knee, you should ideally have it diagnosed by your GP or physiotherapist. Occasionally further investigations, such as an ultrasound or an MRI scan, are needed to correctly diagnose the problem. How can you help yourself? The main thing is to look at what makes the pain increase and avoid these things as you are able. There are several stretches and exercises you can do. A physiotherapist can guide you through these exercises and can help you to put a tailored exercise program together. Biomechanical issues can be a factor. When it comes to choosing what trainers to buy, it is important to know what foot type you have. This will determine what you need from your trainer. Most people overpronate, which needs support and motion control. If you are neutral, then you need a mix of slight support and cushioning. If you are the least common foot type, then you are an oversupinator. You will need lots of shock absorption and cushioning. As you can see, here is some video analysis of an overpronator. Note the tilted in angle of the heels. This is an oversupinator. As you can see, the heel tilts out, and in this example the right is doing this a lot. The final video is of a neutral foot type, which is the heel being close to perpendicular to the ground. There are exercises and insoles that can also help these foot types, as well as the correct trainers. If you play sport with the wrong trainers, then you could risk injury. Remember, prevention is better than cure. Here is an example of some insole correction to an overpronating foot. Exercises. Quad stretch. In standing, lift your right heel up towards your bottom, keeping your knees together and your upper leg and body vertical. Now pull your heel as close to your bottom as possible and hold the stretch for 30 seconds. If you can't reach, then use a towel looped around your ankle to pull it up. Swap and repeat for the left leg. Repeat 3 times a day. In the early stages, the knee joint bending may be more of a limiting factor than the muscle, but the aim is to feel the stretch in the thigh muscle. Hamstring stretch. Lie on your back, lift your right leg up off the ground, keeping your knee straight. Now reach and hold your leg with both hands and pull it up as far as you can while maintaining a straight knee. Hold for 30 seconds, then repeat with the left leg if needed. If you can't reach with your hands, use a towel and loop it behind the leg. Repeat 3 times a day. Calf stretch. To stretch the right leg, take a long stride forward with your left leg, keeping both of your feet pointing forwards. Now, while keeping your back knee straight and your back heel in contact with the floor, start to bend your front knee and lean your body forwards until you feel a stretch in your back leg's calf. Hold for 30 seconds and then repeat for the other leg if needed. Repeat 3 times a day. If you get worsening symptoms or are unsure, then initially reduce the push into the discomfort, and if this isn't enough, then stop altogether and consult your physiotherapist. When things are improving, you can start some light, eccentric strengthening exercises. You should always be pain-free during this exercise and should start with your body weight only. Eccentric squats. Stand on your bad leg and slowly lower your body while keeping your chest up and sticking out your bottom until your knees reach 90 degrees or as far as is comfortable. Make sure that your knee doesn't go past the front of your toes at any point. Your lower back should be slightly arched and your heel should stay in contact with the floor at all times. When you reach a seated position, transfer your weight onto your good leg and reverse direction by straightening your leg and return to the start position. This is 1 rep, repeat 15 times and repeat 3 times daily. This is early rehab and you need to progress beyond this as you are able. Remember, injuries take time to recover and do so gradually, so be patient, there are no miracle cures. If you need any treatment or advice, then call CTC Physiotherapy on 01270 588 244.